Today is Tuesday, January 13th, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Barriers to Buprenorphine Initiation in Patients Using Fentanyl. This is a survey study of 396 buprenorphine-prescribing clinicians in the U.S. to determine if they faced problems initiating buprenorphine among patients using fentanyl and whether their practice had changed as a result. Participants were selected from a stratified random sample of X-waivered clinicians registered with the DEA who had prescribed buprenorphine in 2022, with representation across all regions nationally. Of the participants, 72% of participants reported difficulty with buprenorphine initiation, either precipitated and/or prolonged withdrawal. Clinicians with waivers to treat larger numbers of patients, those reporting fentanyl use by their patients, and those in outpatient settings were more likely to report challenges with buprenorphine initiation. 67% of participants reported they had modified their standard buprenorphine treatment protocols for patients using fentanyl. Next is an article also in JAMA Network Open titled Comparison of Extended-Release Buprenorphine Doses for Treating High-Risk Opioid Use, a Randomized Clinical Trial. This randomized clinical trial compares the efficacy and safety between 100 mg and 300 mg once-daily extended-release buprenorphine doses for individuals with high-risk opioid use, including fentanyl. The study included 436 participants with moderate to severe opioid use disorder and found that both the 100 mg and 300 mg maintenance doses improved opioid abstinence and were well tolerated without any new safety signals. In post-hoc analyses, the 300 mg dose performed better than the 100 mg dose among participants who used fentanyl daily, 14 times or more per week or both. These findings demonstrate that both 100 mg and 300 mg extended-release buprenorphine doses improved opioid abstinence among patients at high risk. The 300 mg maintenance dose may perform better for individuals with heavy fentanyl use. Our next article is in the Journal of Addiction Medicine and is titled Pharmacological Interventions for Electronic Cigarette Cessation, a Systematic Review and Meta-Analyses. E-cigarette use has increased significantly over the last couple of decades and is not without harms. Researchers conducted a systematic review to evaluate pharmacological treatments for e-cigarette use. This review included 4 studies with varenicline, 2 with nicotine replacement therapy or NRT, and 1 with cytosine. Varenicline was found to statistically reduce continued e-cigarette use, but neither NRT nor cytosine showed statistically significant reduction in use. Authors did find that the abstinence rates did trend down over time. Given these findings, the authors suggest there's evidence for use of varenicline as treatment for e-cigarette use, but more studies are needed with respect to NRT and cytosine. Next is an article in the International Journal of Drug Policy and is titled Fentanyl Test Strip Use and Homelessness Among People Who Use Drugs in Rhode Island. This study completed an analysis of data from the Rhode Island Prescription and Illicit Drug Study, or RAPIDS, a 2-arm randomized clinical trial to study the efficacy of a brief theory-based overdose prevention intervention, including fentanyl test strips, or FTS. The study's primary outcome was the association between having experienced homelessness in the past month and use of FTS based on survey data collected for RAPIDS. Recruited between September 2020 and February 2023, 505 people who used drugs in Rhode Island were included in the study. Of the participants, 59% reported experiencing homelessness in the past month, with 93% reporting having ever experienced homelessness. Participants reporting past month homelessness were more likely to report FTS use in the past month at baseline compared to those with stable housing. However, this association was not appreciated in multivariate generalized estimating equations analysis. Additionally, regular use of crystal methamphetamine was associated with recent FTS use, and participants recruited later in the study were more likely to use FTS. Next is an article in Drug and Alcohol Dependence titled Are There Differences in Gradual versus Abrupt Smoking Cessation Quit Attempts and Success by Social Grade, a population study in England. This study examined the success rate of gradual versus abrupt smoking cessation. Data were drawn from the Smoking Toolkit study, a representative sample of the population of adults who smoke in England. Of the 27,000 participants, 45% had quit gradually and 54% had quit abruptly. Those who quit abruptly had higher odds of success than those who quit gradually. Participants from lower socioeconomic grades were less likely to quit abruptly, 53% versus 57% for higher socioeconomic grades. However, the relationship between the abrupt method and higher success was similar for both. Next is an article in Nature titled Put Pressure on Publishers to Follow Best Practice. External Regulation is the Answer. This commentary argues that academic journals should be subject to external regulation to enhance research integrity. Independent oversight could push publishers to crack down on low-quality papers and correct or retract papers quickly when required. The author suggests publishers voluntarily subscribe to an existing international quality management standard so all journals are held to the same standards. This system, quote, could help to balance the commercial interests of academic publishers with the needs of everyone who relies on quality information, end quote. Our next article is in the Harm Reduction Journal and is titled U.S. Drug Policy Does Not Align with Experts' Rankings of Drug Harms, a Multi-Criteria Decision Analysis. U.S. drug policy is often poorly aligned with scientific evidence, with punitive approaches and classifying drugs based on abuse potential, dependence risk, and accepted medical use, but not harm. Researchers adapted a 2010 United Kingdom study to rate drug harms using health, social, and societal impacts criteria. 17 experts assessed 19 drugs across 18 criteria, providing a score on a scale between 0 and 100. Authors ranked fentanyl, methamphetamine, crack, and heroin as the most harmful substances. Notably, many Schedule I drugs such as LSD and mushrooms were rated least harmful, while alcohol and tobacco were considered much more harmful. Harm to the person using was almost universally scored higher than other criteria and was the driving force for much of the overall harm score. The authors note this supports a focus on health interventions over punitive strategies which focus on society. Our final article is in Drug and Alcohol Dependence and is titled Is Cannabis Legalization Associated with Treatment Completion? A Study of Pregnant Women Admitted for Cannabis Use in Substance Use Treatment Facilities 2020 to 2022. This study examined treatment completion for 13,000 pregnant women admitted for cannabis use. Data were obtained from the SAMHSA treatment episode dataset for the years 2020 to 2022. Overall, 28% completed treatment and 72% did not. Treatment completion was lower in states where cannabis was fully legalized than in states where cannabis was illegal and in states where it was partially legal. This effect was larger in outpatient versus residential settings and for patients referred by the court. The authors speculate that cannabis legalization increases the social acceptability and reduces the perceived harm of cannabis use.